Okay. Hello, Dr. Landers. How are you?
Hello, Douglas. I'm well. How are you?
Doing great. Thank you. Thank you for coming on the show. I appreciate it.
My pleasure.
So let's see. You've got a book out called So Many Babies, and on your bio, we're also going to talk about burnout, which I wanted to talk about because I think I suffer from that quite a bit. The So Many Babies and the burnout are not related, right? It's two different things.
They're sort of related. So Many Babies is a book about my experience practicing neonatology in the NICU, the neonatal intensive care unit, for over 30 years. And it tells stories of my being a working mother. And I weave the stories together, professional stories and personal stories. I did personally suffer with burnout at the end of my career, and I write about that in the book. That's not the major emphasis of my book, but I do mention it and talk about my symptoms and discuss ways that I prevented burnout from happening before then.
Okay. Are you retired or are you still practicing?
I've retired about 5 years ago. Um, I was burned out, and I had taken way too much night call in the hospital, and was emotionally exhausted and started to feel detached from my patients, and noticed that I was becoming cynical. Some of the nurses commented that I was cynical, and then the final step was that I started feeling like I wasn't making a difference. And several of my partners said, "Boy, you're really burnt out." They were younger. They were not 62, which is my age at the time. And I said, "Yeah, I've been doing this for a long time." One of the guys looked at me and said, "You're 62? My mom is 62." I said, "Yeah, you're not going to want to be doing this when you're 62. It's hard." So I took a different job, and I went to cover a low risk maternity service and took care of some normal newborns for a couple of years, and just had a great time visiting with parents, taking care of big babies, not seeing any life or death situations. And my burnout got better. I had some therapy, and so I had assistants to help me through burnout. And I reconnected with friends, and I resumed some hobbies that I had left behind. I love needlework. I love cross stitch. It's very meditative. And I just became an exercise nut because I figured out that exercise boosted my mood. And so it took me about 2 years to get through burnout. And then I retired. And it took me about 6 months to get used to being retired.
You know what I love about exercise is not the exercise, but it's how you feel after the exercise.
Amen. It
Yeah.
is such a mood lifter. I would notice when I worked a lot or when I took calls several nights in the hospital and couldn't exercise, I would notice my mood being slightly depressed, not as happy, not as uplifted. It is clearly a major um, tool for recovery for people who have burnout. So I used it, and I still do. I'm still kind of an exercise nut, even as a old retired lady.
I think it's getting started that is difficult for people because initially it's grueling and you
Yes.
just think, oh, forget this.
Well, they say that if you can just get outside and walk,
Right.
the other thing we know now is that being out in nature is really good for your mood as well. And if you can just get outside and walk, even 15 or 20 minutes a day, 30 minutes a day, people notice that it makes them feel better. And they tend to then figure out how to schedule it in their day.
Yeah, very true. One of your talking points that I wanted to ask you about, I wanted to hit on, it says, how does burnout differ from major depression?
Burnout is clearly related to your work. Men feel physical exhaustion first. Women tend to feel emotional exhaustion. That's followed by depersonalization. You sort of detach from your patients. And then the final piece is not feeling fulfilled, like you're not making a difference. Now, some of those feelings can be present in depression, but in depression, you feel really bad in every aspect of your life, at home, at work, with friends, whatever. When you're burnt out, it's clearly something that bubbles up at work, about work. And when you go home, you don't feel that way. And when you're with friends, you don't feel that way. You might complain, but your mood is not depressed like it is with a general depressive disorder. Does that make sense?
Yeah, I think so. I think to put it simply, depression just stays with you no matter what you're doing. Burnout is more restricted to your work environment.
Exactly.
Yeah.
And people tend to notice that they dread going to work when they're burnt out. My husband noticed that. He said, I've never seen you like this before. You just don't even want to go to work. I said, yeah, I'm just sick of it. I'm just, up to here. And so there are clearly distinctions between burnout and depression. But people have to talk about it. Whether they're burnt out or whether they're depressed, they need to talk to a loved one. They need to talk to peers. They need to get help, because sometimes it is so overpowering that we don't know how to get out of it.
Well, and I think also with depression too, it can last for a long time.
Yeah, that's a bad thing about generalized depression or a major depressive disorder. I had depression when I was 40 after the birth of my third child. And I didn't realize postpartum depression could occur up to a year after birth. But I was also in a situation where I didn't like the job I was in, and we had moved to a new city, and I was without friends and a support group. But that depression affected every aspect of my life. And I got better with therapy and medication. Burnout didn't feel like that to me. Burnout felt all about work.
So if you stopped working at the point where you felt burned out, you got better?
I kind of ratcheted down my work. I went to work 3/4 time, and I only worked about 35 hours a week. I was still helping my practice, and I did that for 2 years. So when you work less, you can do more hobbies, exercise, visiting with friends, cooking, whatever, makes you happy. And so over a 2-year period, I recovered.
So many babies. I see the cover behind you. Let's talk a little bit about your book. So tell us the idea of the book.
I wanted people to know what it was like to work in a NICU. And as I recollected stories of my most special patients and their parents, I was reminded of how inspirational these parents were, how they had met huge challenges and having a baby in the hospital for 3, 4, 5, 6 months even. And so I wrote about the NICU stories, picking out the best cases and some of the worst cases that I found most challenging. And then what I tried to do, and I think I accomplished, is weave with those professional cases my own personal tales of motherhood struggles. So often in the NICU, I would talk to other NICU moms, and I would say, oh, my daughter's having trouble with this, or my son's struggling with that. And they would go, I can't believe your children have any trouble. They should be perfect because you know what you're doing. I said, oh, no, I don't. None of us know what we're doing. We're all just trying to be the best mom we can be. And I was convinced that all working mothers worry about how well they're doing, whether they're really balancing work and family. And so I wanted my story to tell how I balanced work and family.
Can you just give the definition of NICU? I know it's short for something.
Neonatal intensive care unit.
Okay.
NICU is a place in a hospital that has where mothers give birth. The NICU is usually a secluded unit where tiny preemies or sick newborns or babies with birth defects can be cared for with careful monitoring. So if a mom comes in the hospital and has a baby, that baby is in a normal newborn nursery or stays with mom in her room. A NICU is like an ICU, except it's for babies.
Is there any percentage of babies that are born that require that?
Exactly. About 10% of newborns will either have prematurity or low birth weight and need to be born in a hospital where people like me and neonatal nurse practitioners and other nurses know how to take care of them. Another 5% of children have some kind of birth defect that may or may not have been recognized before delivery, and those babies need care in a NICU. So NICUs generally will have some premature babies, some sick full-term babies, various stages of growth for babies who have birth defects, whether it's a heart defect or kidney defect. And we work with all kind of specialists to sort out what's going on with the babies.
So you said you were retired and you've been retired for 5 years?
5 years exactly.
Okay, so what
Right.
have you been doing aside from writing your book?
Writing my book, chasing my 2 grandchildren around, exercising, visiting with friends. I did manage to sneak in a couple of trips, one to the Virgin Islands and one floating down the Grand Canyon.
Oh,
And
nice.
this was before COVID hit. So I have enjoyed my time off immensely. Being a grandmother is just icing on the cake.
How old are your grandchildren?
4 and 8 months, 4 years and 8 months.
Oh, well, good ages. Yeah.
Yeah, they are. Yeah, I can really help too.
Oh, that's terrific. So any plans for another book?
I'm thinking about some of the topics that I left out of this memoir. The publishers wanted to keep it short and sweet and really focus on my years as a mother, but I had lots of interesting experiences in med school, residency, fellowship, and then during my practice, instances, interacting with other doctors, more information about my relationship with my husband. And so I've kind of been thinking about putting together another book. So I don't know. We'll see.
Well, Dr. Landers, we do have to wrap this up. Do you have a website that you want to give out?
Oh, I do. It's SusanLandersMD.com. HTTPS :/SusanLandersMD.com. And all of my social media links are available there. I'm on, Twitter, Instagram, Facebook, and links to buy my book are there too to make it easy for people.
Okay, super. How long has the book been out?
The book has been out since September 14th. The ebook came out in May. I also have a blog with lots of information for parents. I write a blog about topics such as breastfeeding and co-sleeping and RSV and just things in general that are pediatrician kind of things for a general population to know.
Okay, great. And the blog is linked on your website as well?
Exactly. It's a whole separate page in my website.
Okay, great. Well, thank you so much for coming on this show. This was nice talking to you, and best of luck with the book.